can write your questions down, or you can put your hand up when it is time for the question and answer session. So let's start off with our expert views now, as we welcome Professor Adesegun Fatusi. He's a Vice Chancellor, University of Medical Sciences, Ondo State. Professor Fatusi serves as a consultant to several government agencies, international development organizations, and United Nations agencies. Thank you so much, sir. Professor Fatusi, you have the floor now.
Thank you very much, and good evening to everyone. Good morning, good afternoon, good evening, depending on where you are. And let me start by thanking Adeola for inviting me to be here and to congratulate her. I'm sorry, it looks like I'm in a very dark place. Forgive me. I hope you can hear me, even if you can't see me well. I'm sitting down in a car park somewhere.
We can hear you, sir. Thank you, Prof.
Okay, thank you. So firstly, let me congratulate Adeola for what she stands for and the courage with which she had faced situations. Challenges in life will make us bitter or better. But when we take our pain and translate it to an instrument to impact the life of many others, then truly we are people who show strength, who show courage, and who wants to leave an impact. So let me go to my topic about why fertility matters, the public health perspective. Okay, I think it's better. I think I've put on light in the car. The public health perspective. I think there's one word that summarizes everything I would like to say, and that is empowerment. Like we know, information empowers, information enables, information transforms, information makes people be able to take those kind of critical decisions that we need to make. And for public health particularly, we are always looking at the issue of prevention. And when we take a look at this, a lot of us here, I know a lot of my colleagues are here, we do a lot of work around sexual and reproductive here. We do a lot about, let's prevent pregnancy, let's prevent STIs, let's get young people the information, let's talk about life planning, let's talk about sexual education. But really, let's talk about family planning. But really what we are doing is not talk about family planning because the intent of family planning is to enable people to achieve their fertility desire. It is not about, it must be they must not have children. Yes, if that is what the person desires at that age and time in their life, or a young girl doesn't want to have pregnancy, yes. But really, contraception and conception are two sides of a coin. And therefore, we need to balance the message. We need to balance the focus. Even though I work in the field of adolescent and I've been working there for many years, I have hardly been seeing people talking about fertility education. And so I think that we need to begin to do that. So why does it matter? One, we need to help young people to understand, and clearly so, that when it comes to fertility, there's a biological clock that is there running. And that biological clock does not even start. So it's not about when you are getting older or when you are getting to a particular age. We need to let people understand, even from the very early age, things that could affect their fertility, smoking, some kind of anxiety, some kind of food. So in the very early stage of life, we need to begin to empower people. So we need to help people very early in life, young people, to understand about fertility so that they can make the kind of decision that they need to make. The decision about, do you want to be pregnant? Decision about, do you want to freeze your egg? Those are very important. It will empower people to know exactly what they want to do, at what time they will need to do it, and with what in result, and with a dimension of intentionality. That's one dimension. Number two, we do know that if you are able to truly empower people with that kind of knowledge, and we give them that kind of opportunity to acquire the knowledge they need, you'll be able to, you will have opened a path for them to be able to know where to seek help, where to seek support, where to seek the kind of support they need, be it psychosocial, be it physical, be it medical, be it spiritual. That's the other dimension. It's also important that even when we're talking about the fact that people even seek solutions, and they have shared their experience, there are challenges They even know where to go and what next to do. And so at the center of all of this is that opportunity to empower people so that they take the action that they really desire for their own life and to make them achieve the intention they want, and to be able to have the kind of quality of life even in the midst of challenges. And so we need to begin to re-examine our focus within the sexual and reproductive space, to shift our gaze from just talking about, oh, let's stop teenage pregnancy, let's stop STI, let's think about contraception, to begin to talk about conception as a part of the spectrum that people need to know. We need to begin to look at our program in schools. We're talking about life planning, we're talking about fertility education. We need to begin to look at the content to be sure that truly it is comprehensive